Good afternoon, everyone. Thank you for joining us. Thank you for joining today's community of practice session. My name is Danny Hansler, and I'm going to be your host and tech producer for today. We're excited to bring you this important discussion. As you can see on screen, the discussion this time around is substance use, mental health, and dating violence. We have two speakers that are ready to share with you their insights. But before we begin, we want to go over a few reminders before housekeeping items. Today's session is on Zoom, so you know the usual features of Zoom. So make sure that your microphone is muted unless you are participating in the program. You can find your microphone settings at the bottom left and also mute it right there. This meeting is being recorded, as you heard the notice at the beginning. So to ensure that you remain anonymous, if you wish to do so, you can turn off your camera, but you're welcome to leave it on. Please also remember to avoid sharing any personal or confidential information in the chat. Also, we have the Zoom engagement tools. We can participate with our questions in the chat. Also, we have the reaction buttons at the bottom. We can make full use of those to participate. And we encourage you to do it, as it makes the session more interactive and engaging. If you would like to raise a question or a point, we're going to have a Q&A session at the end. But at the beginning, we're going to start right now with Elizabeth, who is going to handle the bios and get the discussion started.
Hello, everyone. Good afternoon. I would like to introduce Marissa Carlson, who is the Executive Director of the New Hampshire Teen Institute, a leadership development nonprofit working with middle and high school students from around New Hampshire and New England in a variety of areas, including substance misuse prevention, peer mentoring, and creating positive school and community climate. As a part of her role at Teen Institute, she oversees and facilitates training for youth participants, youth and adult volunteer program staff, and outside behavioral health and education professions. She is a trainer for multiple workshops developed through SAMHSA systems and is a member of the advisory council of the New England Prevention Technology Transfer Center, PTTC. In addition, she is the president of the Prevention Certification Board of New Hampshire, serves on the ICNRC Board of Directors, and serves as the chairperson of the ICNRC Credentialing Committee. Outside of her prevention work, Marissa is a founding member of Mill City Productions, a theater company in Western Massachusetts. She graduated from Pomona College with a bachelor's in psychology, received a Master's of Science in Nonprofit Management from Bay Path University, and has been a certified prevention specialist since 2011. I would also like to introduce Lori Barger-Sutter. She has 3 decades of experience developing sustainable public and behavioral health systems that can solve complex social and public health issues and enhance the well-being of people. She's conducted hundreds of webinars, workshops, and training events for state and federal agencies, including the Substance Abuse and Mental Health Services Administration, SAMHSA, the U.S. Centers of Disease Control and Prevention, the U.S. Department of Education, and the American Public Health Association. Her strategic planning and health system assessment, planning and evaluation tools and processes have been used to strengthen organizational and health outcomes in all 50 states and 10 federal jurisdictions. As the CEO of Growth Partners, Lori oversees technical assistance to multiple states and communities in addition to administering the New Hampshire Technical Assistance Center for the Bureau of Drug and Alcohol Services. Prior to founding Growth Partners, Lori directed the state technical assistance contract for SAMHSA Center for Substance Abuse Prevention, where she oversaw prevention system assessments and technical assistance for all 50 states and 10 federal jurisdictions. Lori also has experience in state government, having served as a state prevention director and National Prevention Network representative. She has extensive experience in working with communities, state, tribal, territorial, and federal agencies and organizations, and was named an Advocate of the Year by the Community Anti-Drug Coalitions of America. for her work in helping secure passage of the Federal Sober Truth on Underage Drinking Act. Flipping it over to Ann Crawford to get us our objectives for this COP.
Thank you, Elizabeth. Hi, everybody. Ann Crawford. I don't get to have introducing the exciting stuff you just listened to, but today's objectives, by the end of today, we hope that participants will explore trends in 2023 YRBS data, examine how 2023 YRBS data shows a decline in substance misuse. At the same time, it points to a concerning rise in other issues, such as dating violence and mental health outcomes. Also gain an understanding of shared risk and protective factors.
Well, good afternoon, everyone. I'm Lori Barger-Sutter. Thank you for inviting me to be part of your COP today. Next slide, Danny, please. I'm going to start with just a brief overview of the methods that we use to analyze YRBS data, and to back up, we were asked to take a look at New Hampshire state data set for YRBS to look at both trends in substance use, mental health, and dating violence, as well as correlations between those and other potential factors. So I'm going to be moving through that information quickly, looking at trends, incidence, prevalence, and then those correlations. And I'll be moving quickly with showing you a lot of information, but then wrapping it up at the end. Okay, next slide. We use two basic kinds of analysis. The first is simply descriptive, which means that we go in and we look at what the students who participated in the survey reported experiencing. So this kind of analysis, which we'll share today, only provides information about the students that participated in the survey. It can't be generalized to the larger population. Key things that this can tell us, though, are how common certain behaviors or problems are, how quickly they are increasing or decreasing, and then changes over time. And so knowing incidence and prevalence helps us to really keep an eye on what is happening, as well as new things that may be emerging. Next slide. So when we get into the correlation work, which we'll be showing later in my presentation, we're using an advanced analysis technique that requires a statistician that's trained to do that kind of work. In this case, the statistician worked with New Hampshire YRBS data to model it in a way that it can be generalized to all students, not just those who participated in the survey. They also used inferential techniques to tease out the strength of relationships between what we call outcome and explanatory variables. Outcome variables are behaviors and conditions of interest. So in today's presentation, we're going to be looking specifically at substance use, mental health, and sexual and dating violence. Explanatory variables reflect behaviors and conditions which increase or decrease the likelihood of those outcome variables occurring. And then finally, p-values, which is short for probability values, are used to establish confidence in the validity of analysis results. So a p-value of 0.05 means that there is just a 5% chance that the relationship is due to coincidence, and a 95% chance that it is an actual relationship. That's the highest p-value that we use. The smaller the value, the more reliable the data. So for example, a p-value of 0.01 means there's just a 1% chance that the relationship is coincidence, and a 99% chance that it's an actual relationship. So everything I show you today is going to have a p-value of 0.05 or smaller, meaning 95% accuracy or confidence level. Next slide. two important caveats to the data that I'm going to show you. Although we looked at dating violence and sexual violence, mental health, and substance use as outcome variables, and other factors as explanatory variables, it's not completely clear which direction causality may run. So the correlations are there, but what causes what, we can't say today. For example, experiencing depression may make students more vulnerable to relationships in which they're the victims of dating violence, but experiencing dating violence can also contribute to depression. On the same note, students who were not at risk of an outcome were not included in the model. So, for example, students who reported not dating were not included in analyses looking at dating violence. So let's look at who participated in New Hampshire in the 2023 YRBS. In total, 12,821 students, but after initial analysis and cleaning, and I need to say the YRBS data set is fastidiously cleaned, and any responses that may not be accurate are removed. So the final data set in New Hampshire was not quite took out about 180 responses were removed for a total of 12,640. Next slide. This table illustrates participation. We can see that in 2021 there was declining participation, which increased in 2023. So while there are some schools represented from these regions that didn't have a regional report, they also had insufficient participation to get that report. So it gives you a look at where the bulk of the responses came from. Next slide. All right, grade in school. We can see, and this is a good thing, we can see that the responses were fairly evenly distributed among 9th, 10th, 11th, 12th grade, and males, females. So there's no skewing toward any particular grade or sex. Next slide. Race and ethnicity is illustrated here for 2023. Student responses were slightly more diverse than what the U.S. Census Bureau projects for 2023 for New Hampshire. So white only 87%, Census Bureau was about 92.5. Same thing on the Hispanic Latino, with a little more Hispanic Latino representation than what is represented overall in adults. Next slide. For gender, we can see that 93% of students reported being cisgender or identifying as the same gender as the biological sex that they were born with. Transgender 4.5, students reporting unsure 2.6. For sexual orientation, 74% of the students who participated reported being heterosexual, 17% lesbian, gay, or bisexual, and almost 10% reported being other or questioning. Next slide. And then finally, academic grades, we can see the students that participated, most of them reported receiving mostly A's in schools, followed by B's, and then smaller numbers reporting C's, D's, F's. Next slide. All right. So we know that overall adolescent substance use has been declining in New Hampshire and across the U.S., although there was a slight uptick in 2023 over 2021 for several substances. On the next set of slides, we're going to be looking at trend data from 2003 to 2023, drawn from New Hampshire's YRBS. It's important to keep in mind that we need to exercise caution in comparing 2021 data to other years because of the disruptions caused by the COVID-19 pandemic, which included remote learning, the lack of social interactions, and extracurricular activities. and also the delay in survey administration until the fall, which meant that younger populations completed the survey for each grade than is typical. So here we can see current alcohol use declining pretty steadily, even more so in 2021. When you remove that dip for 2021, you see this overall decrease, with New Hampshire students tending to report lower alcohol use, slightly lower compared to their peers, and that decline really continuing even when we correct for the COVID-19 dip. So next slide. Same thing here. We can see generally declines in driving and drinking, although in 2023, there's an interesting uptick in males reporting drinking and driving, which didn't track with female trends. Let's go to the next slide. Current vaping trends, we can see New Hampshire tracking along with national, that interesting kind of spike from 2017 to 2019, but then fairly general decline or fairly steep declines after that. Again, if we correct for that 2021 COVID year, we still see significant decreases. One thing that is interesting in these slides shows that how females began to emerge as vaping at higher rates than their male peers beginning in 2019. Okay, next slide. Current marijuana use. Now here's one where we do see New Hampshire students consistently reporting higher rates of current marijuana use than their peers nationally. And that we see again in 2021, 2023, those female rates beginning to rise above and exceed male rates. Next slide. And then I want to spend a minute explaining this construction because it's one that our statistician used. When we get into the correlations, you'll see this be used as a measure to look at relationships between sexual and dating violence and substance use. She used a model that was created in a national study this year in which involved collapsing different types of substance use into one category. Because our analysis for this presentation was so large, we needed to find ways to collapse data points so that it was manageable to do before this session. So students who reported using one substance meant they said yes to one of these things, either a past 30-day use of alcohol, tobacco, vaping, marijuana, or prescription drugs, or they said yes to lifetime use of prescription pain drugs, inhalants, cocaine, heroin, methamphetamine, or ecstasy. If they reported using two substances, it meant that they reported affirmatively to two of these different categories. And it could be any combination of them. Same thing for three or more. So they might have reported two types of past 30-day use and one type of lifetime use. With deeper analysis, we can tease those out if we're interested, but for the purposes of this analysis and study, this is the construction that we used. Next slide. So while substance use has been declining nationally and in New Hampshire, we are seeing poor mental health increasing, peaking in 2021 and then improving slightly in 2023. But again, with those, when you adjust for the COVID spikes, we still see upward trends. So let's look at the next slide. Mental health and depression trends. And in this blue box, you can see the actual question that students answered. And again, we can see this really starting in 2017, this very steep incline, again, decreasing slightly in 2023. But if you take out that 2021 data point, you can still see that in each case, these indicators are moving in a undesirable direction. Next slide. Here we see suicide ideation, again, from about 2017, beginning to move more steeply peaking in 2021, but still take out that 2021 data point, you've still got a pretty good increase, especially for females in New Hampshire and New Hampshire overall. Let's move to the next slide. Here we're looking at making students who reported making a suicide plan. Now there are missing data points, as we can see, from 2011 to 2019 for New Hampshire. That means either the question was not asked or the question was asked in a way that made it not comparable to the question that was asked in 2003 to 2011 and 2019 to 2023. But again, we can see, correct for that spike in 2021, take that point out, we still have fairly significant increases in suicide planning. Let's look at the next slide. Okay, attempting suicide, we see similar patterns here. In general, New Hampshire students have reported lower rates, but we can see this very high rate that's reported by New Hampshire females compared to males. Let's go to the next slide. This one's a little more erratic, but it's erratic all the way through. But the interesting thing here, which is that these injuries did not decrease as much as national rates in New Hampshire. So if you look at this yellow national line in 2003, after COVID, we see a pretty good decrease nationally. In New Hampshire, the decrease is much more minor, and that's because you can see this green line of males trending upwards. So females decreasing, national decreasing, males increasing. Kind of an interesting look. Let's go to the next slide. And then students who in 2023 reported their mental health was not good in New Hampshire. This is another thing we looked at carefully when we analyzed relationships to dating violence. So we can see about 37% of students reported that their mental health was never not good or rarely not good. And 63% reported that it was not good sometimes, most of the time, or always. Next slide. A question that was introduced in 2021 and then carried over to 2023 asked students if they had ever lived with persons with serious substance use or mental health problems. And we can see that a fairly good number of New Hampshire students reported affirmatively to both, with more reporting living with someone who was mentally ill or suicidal or depressed, and those numbers increasing slightly in 2023 over 2021. Let's go to the next slide. Okay, sexual and dating violence. Now, like mental health, these have been increasing in New Hampshire and across the US. And while we're looking primarily on YRBS data in this presentation, other national studies provide additional information that help shed light on this. And I want to take a look at some findings from a study that was funded by the National Institutes of Justice called the National Survey on Teen Relationships and Intimate Violence, or STRIVE, which was the first comprehensive national household survey that focused on teen dating violence, and it used detailed measures of victimization and perpetration. So I want to share a few interesting findings from that survey before we move on to the New Hampshire YRBS data. Next slide. So findings from this, and you're going to have to click the, yeah, there was a high overlap between victimization and perpetration. Over 84% of victims of abuse also reported perpetrating abuse, meaning that relationships that were characterized by violence typically involved mutual violence, increasing in high levels of dating violence associated with individual and family characteristics. For example, the children of parents who experienced verbal abuse and physical violence by their partners were more likely to experience abuse and violence in their own dating relationships. And then finally, teen dating violence, victimization, and perpetration were found in both low and high crime neighborhoods. But the one difference they found was that males who lived in neighborhoods with greater gender equality were less likely to report perpetrating relationship abuse. Okay, a few more slide findings. Higher levels of controlling behaviors by both partners associated with higher rates of dating abuse, victimization, and perpetration. Youth who were exposed to any kind of violence were 3 times more likely to experience high levels of relationship abuse and sexual harassment. And then finally, males who believed in traditional gender stereotypes were more likely to perpetrate sexual harassment. And in this study, sexual harassment was defined as unwelcome sexual comments, jokes, or gestures, or physical intimidation in a sexual way. So let's take a look at what New Hampshire students report. This question is not specific to a dating partner, but it does help illustrate the prevalence and incidence of sexual violence in general. As you can see, there's been a steep increase in New Hampshire students reporting being forced to have sexual intercourse during their lifetime. If we look at the beginning in 2003 to 2010, the rates nearly doubled. On the next slide, we'll take a look at which students report being most impacted. Throughout the analysis, we used a risk ratio of 25% or higher to identify the characteristics of students most likely to experience a problem. This means that students with characteristics displayed are at least 25% more likely to report experiencing this issue than their peers. So first of all, who's most likely? 11th and 12th graders. Females were more than twice as likely as males. Black African American students, followed by American Indians, Alaskan Natives. White students were the least likely, and that was something that carried across all analyses. Students who are lesbian, gay, or bisexual compared to heterosexual. Next slide. And we also looked at mental health and substance use as an explanatory variable for the outcome of sexual and dating violence. And what we found was that students who reported experienced depression were at 25% or more likely. They also reported seriously considering suicide, attempting suicide 1 or more times, using 2 or more substances, and living with someone with a substance use problem. Another characteristic was students who reported trading or having sex in exchange for food, housing, money, or other items of value were more than 3 times as likely to experience forced intercourse. We looked at the data set, and 3.1% of all New Hampshire students reported in 2023 trading sex for money, food, housing, a place to stay. Male students were slightly more likely to report this at 3.3% compared to females at 2.9%. This was the highest predictor across the board of students experiencing violence, as we'll see in subsequent slides. So let's go to the next slide. Past year sexual violence. Again, this one is not specific to a dating partner, but like the previous question, it helps establish general prevalence and incidence. This question was introduced in 2017. As you can see, New Hampshire was still trending upward as of 2023, while US rates were leveling off. So let's look at who is most likely to report. And we see females are more than 2 times as likely as males. Students who are Native Hawaiian, Pacific Islander, or report being of 2 or more races, and students who reported receiving mostly Ds. When we look at mental health and substance use, again, we see these students reported experiencing depression, reported poor mental health at any frequency other than never, which means that even students who reported rarely experiencing poor mental health were at least 25% more likely to have reported also experiencing sexual violence. These students reported seriously considering suicide, making a suicide plan, attempting suicide 1 or more times, using 2 or more substances, driving after drinking alcohol, and then trading sex for food, money, housing, things of value, 2.6 times more likely. Next slide. This question was introduced in 2023, and it spans, it doesn't specifically reference a dating partner, but it alludes to a dating relationship, and we can see that 13% of students reported being coerced into doing something sexual that was unwanted in the past year. Again, let's look at the characteristics of the students: females, heterosexual, and LGBT, and students who received mostly Fs. We look at mental health, substance abuse. Again, there's that depression, report of poor mental health, attempting suicide, using 2 or more substances, drinking and driving, and trading sex for food, money, housing, things of value. Okay, next slide. Now, with this slide, we are looking specifically at dating relationships, and we can see after a pretty steep decline from 2015 to 2017 at the state and national level, rates began to rise again and steadily increase in New Hampshire and across the U.S. Next slide. Again, we see females more than twice as likely as males. Black African American students, followed by American Indian and Alaska Natives, LGB, and students who responded that they were other or questioning, students who identified as cisgender compared to those who reported being unsure. Cisgender and LGB were fairly close. LGB was not quite significant enough to be 25% higher than unsure. And then students who reported mostly receiving Ds in school. And then let's look at the mental health. Again, reporting depression, poor mental health at any frequency other than never, meaning again, those students who said rarely were still much higher than students who said never, considered suicide, made a suicide plan, attempted suicide 1 or more times, used 2 or more substances, drinking and driving, trading sex for food, housing, money, things of value. Okay, let's look at physical dating violence. This one is interesting. There's not a data point yet for 2023, as there's not in some of these slides. So we don't know what direction it moved nationally. I think that national data will be out after the first of the year, but the CDC did produce a trends report, which was gave us a data point for some of the other graphs we showed you. But look at this interesting thing happening here with 2019 to 2021. Steep increase in females, slight drop in males, but then the overall trend in New Hampshire goes up pretty significantly, and that's due to the steep increase in males reporting having experienced physical dating violence. So let's take a look at the characteristics. Males were 32% more likely to report being the victim of a physical assault by a dating partner. And that Strive data that I spoke of earlier found that nationally, females ages 15 to 18 report perpetrating moderate threats or physical violence at more than 3 times the rates of males. That was surprising to me. Asian, followed by Black, African American, Native Hawaiian Pacific Islander students, more likely students who said they were other or questioning, cisgender compared to transgender, students who received mostly Fs. Let's look at the next characteristics. These students tended to report always experiencing poor mental health, seriously considering suicide, making a suicide plan, attempting suicide, using 2 or more substances, driving and drinking, living with a person at some point in their life who had an alcohol or drug problem, trading sex for food, money, housing, or other items. And then our last category here, emotional dating violence. We can see this question was added to the data set in 2017. Controlling for the 2021 spike, we still see a gradual upward increase over time. Let's take a look at these students. These were students, mostly cisgender, reported D's or F's. And although ninth graders were not 25% more likely, we can see that they had the highest rate. So 31% of all ninth graders who reported dating reported experiencing emotional dating violence, and those numbers gradually decreased over time. Those other characteristics of those students, next slide. Not surprisingly, experienced depression. Again, poor mental health at any frequency other than never, which means even those who reported rarely were much more likely, attempted suicide, used substances, 2 or more, drove after drinking, traded sex. All right, and then the new question this year asked about perpetrating emotional dating violence. So it asked about, did you try to control or emotionally hurt someone? And in this case, ninth graders emerge again as significantly more likely. Next slide. Yep. And female again, so females and ninth graders. And again, that Strive survey found nationally females 15 to 18 reported perpetrating serious psychological abuse at 4 times the rate of males. Asian students were more than 2 times likely than all other races to report perpetrating emotional dating violence, and then students who received mostly D's or F's. So we're going to wrap it up here because I've just given you a whole lot of data. So let's move to the next slide where we've just put it all together and summarized. So across the top, you see our outcome variables for different types of sexual and dating violence, from ever forced to have intercourse, sexual assault by anyone, moving through the categories that I just showed you. So we can see here for grade, grade was relevant in 2 of those. In terms of sex, largely females, except for that dating violence. It was neutral for emotionally controlled or hurt neither males nor females. For race, we can see that students other than those who reported white are primarily presenting as having the greatest risk. Sexual orientation, a little mixed, but we see heterosexuals on the coercion. Otherwise, where it pops up as significant, it's students reporting as LGB or other questioning. In terms of gender, or cisgender shows up in 3 of those categories. And then on the bottom line, we can see that students are reporting mostly poorer grades, or in one case, not sure of their grades, or none of those grades. And then the last slide, next slide. Let's take a look at explanatory variables related to mental health, substance use, and other. So we can see, as we saw as we went through the slides, depression shows up for everything except for physical assault. Poor students reporting poor mental health shows up in every case except for ever forced to have intercourse. We see suicide ideation showing up in every category except tried to emotionally hurt or control a dating partner. Substance use showing up in every category except, again, for that emotionally hurt or controlled by a dating partner. Drinking and driving shows up as a common correlation for everything except forced. Living with a person with an AOD problem shows up in 2 cases. We also looked at lived with a person with a mental health issue or depression, and it was not, while some rates were higher, it never met that 25% threshold. But then we see what that category that I talked about earlier, traded sex for food, housing, money, things of value, is the most significant predictor. All right, next slide. So I just want to end on this slide about the Technical Assistance Center. It is funded by BDAS to provide technical assistance, including YRBS analysis and use. So if you're interested in taking this kind of look at your own local YRBS data or on a different topic, visit our website at nhtac.org or contact Melissa Sylvie, our director. Last slide. And thank you again for inviting me to your COP today. It's great to be with you.
Thank you, Lori. That was a ton of information.
It was.
So we will have an opportunity after Marissa's presentation to ask questions and pick Lori's brain or Marissa's brain if you so choose. Feel free to pop your questions in the chat and we can address them afterwards if you would like. And then I will throw it over to Marissa Carlson to start her presentation.
Awesome. Thank you so much. And again, thank you, Lori, for sharing all of that really important information, definitely some heavy information. So I know we're probably thinking about, certain youth that we know or, young people we come in contact with that, have maybe kind of struggled with a couple of these different issues at different times. And what we want to do for this part, right, is to put in that hopeful piece. We're going to think about, all right, we know this information, we know some of these things that are kind of co-occurring for our young people. What can we do about it? And how can we get more people excited about prevention efforts through looking at some of these shared risk and protective factors that cross over sort of between substance use disorder risk, substance misuse risk, and then some of these other things that Lori just presented on, right? Thinking about intimate partner violence, thinking about depression, anxiety, things like that. So we are going to kind of just start. I know some of you in the room could absolutely just, teach this part yourselves, which is wonderful. So I apologize that for our more experienced folks, just a quick review on risk and protective factors just to get us all up to speed. We'll do this for just a little bit and then kind of go again, talk more about kind of how do they overlap? Where do we see these working together? All right, I can take the next slide. All right, so a good reminder or maybe new information for some of our new prevention professionals in the room. A risk factor is a characteristic at the biological, psychological, family, community, cultural level that precedes and is associated with a higher likelihood of problematic outcomes. So this is something that we see that comes before these concerns that we might have. So it's maybe something we're seeing, before anyone gets involved with the substance misuse or experimentation, before we're necessarily seeing some of these the mental health outcomes we don't want to see. It's something that happens kind of beforehand, and we know from the research that's been done that it's a predictor. It doesn't mean someone, just because they have a risk factor, is destined to have this particular issue, or any of the things we've been talking about today. But it does mean they're at a higher risk for it. So it's something that we want to keep in mind. Kind of the flip side of that, if we go to the next slide, is that we also have our protective factors. Oh yes, the arrow flies in. So as a reminder, so the protective factors, you'll also see at the next click an arrow going down, a characteristic at the biological, psychological, family, community, cultural level that precedes and is associated with a lower likelihood of problematic outcomes, right? So when we're thinking about protective factors, we're thinking, what are those things that help mitigate that risk, right? So whatever kind of profile of risk factors and combination that someone has, what are some of those protective factors that come in and help then reduce the risk that they might be getting from some of the other things going on in their lives? So oftentimes when we're working in communities or in the schools or kind of working with individuals or working at the community level, we're often looking at hopefully impacting a range of risk and protective factors when we're thinking of kind of that holistic prevention work that we can do. So protective factors are often things that help get more people to the table. They're often those really positive things that have a lot of wonderful impacts across a lot of different outcomes. And we'll go to some examples in just a minute. But when we see protective factors, that's sometimes the kinds of things that help get people to our coalition tables or kind of get them more involved at school or get them more involved in, kind of adding things to the community and adding things to people's lives as individuals. So we're always going to be a mix. We ourselves, right? Everyone in this room is kind of a mix of risk and protective factors from the way that we've grown up and the way that we've been living our lives. And the folks that we work with, whether you're working with the youth or working with adults, it's going to be, we're all this combination of risk and protection. And so we are often trying to, at that prevention level, work with folks to mitigate that risk and improve that protection. And look at the next slide. And the other big review or new information for folks that are newer to prevention is we are often trying to impact those risk and protective factors in multiple contexts. So some people have seen this diagram as like context. Some people we talk about as domains. There's a few different ways to look at this. This particular model is the model that SAMHSA uses. So that's why we've included this image in this particular slideshow. But what it gets at is that as an individual, there are things, there are risk and protective factors that happen at that individual person by person level. So some of these things are going to be inherent about, kind of where folks are, sort of where folks are born, some of the things that impact them right away in early childhood, things about personality, right? We know that if folks are really like high sensation seeking, that can be a risk for things like substance use disorders later in life. So some of those things that are related to personality, physiology, if someone has a history of substance use disorders in their family, right? We know there may be a genetic component to some of that. So that's what we're thinking about. We're thinking about risk and protection at the individual level. Some of those protection pieces can be, things like having goals for the future and feelings of self-esteem and self-efficacy, right? So we're thinking about the individual. We're going to see risk and protective factors living there. We also know that then kind of broadening out, we might be looking at risk and protective factors at the family level. So that family level, right, is going to be things like, for youth, it's going to be things like parenting. It's going to be things like, are parents good at communicating their expectations around some of these behaviors, especially around substance use? And are there clear standards for how parents expect, or guardians expect their young people to behave and kind of carry themselves? We often talk in prevention about parental monitoring, which is kind of a jargony word that we use for, our parents supervising their young people. If they're not directly supervising, do they know where they are? Kind of, do they know who might be around their children? Who are their friends? Who are the folks that they, spend time with after school, that kind of stuff. So sometimes we're looking at the family level. Let's see. Then we are looking at the community level. So when we're thinking about the community, we're thinking often about like school and friends, especially if we're thinking about young people. We also might be thinking about, some of those environmental things that are going on, right? We could be looking at what's happening in terms of liquor stores around, or depending on state, or people are working in like cannabis dispensaries, things like that. What are people seeing in their environment? So it can be that kind of what's going on in school, what's going on in someone's individual life. It's often to that neighborhood that they're around in as well. As you can see, Maura has put something in the chat for just a little bit. We'll get to that, but you can absolutely feel free to start looking at that if you'd like to. So then society, right? We're often thinking at that society level around those big picture policies. So maybe looking at state policy, looking at federal policy. What are those things that we keep that are helping people like live their best wellness lives? What are some of those things that are going into play? What are some of the norms in our society, right? What are some of the norms around substance use? What are some of the norms about asking for help if you're experiencing depression or anxiety or other mental health concerns? What are those things about asking for help if you're experiencing intimate partner violence, right? So there's going to be some pieces of the society risk and protection is going to be those harder to pin down, the kind of norms that we're just kind of supporting. Someone's going to be really like specific in terms of what is the legislation that we see happening, and does it support mental health and wellness, or is it something that hurts people's mental health and wellness? Before we move forward, any questions from folks around that kind of quick reminder about what we're talking about when we're looking at what a risk factor is, what a protective factor is, and where in our society and our community and family and individual do we see them. Awesome. Okay. Feel free, obviously, if you think of a question later on, don't hesitate to put it in the chat. All right, we can go to the next slide. So here's just some reminders of what some of our kind of big picture risk and protective factors are when we're thinking about adolescent substance use. So we have a moment to look at this, and I'll kind of bring up some explanations for any that maybe don't seem 100% clear as you're first looking at it. Emotional problems in childhood, kind of a catch-all, right? And we put some examples of how some of the research describes different things. You'll often see when we're thinking about risk and protective factors, there's not like one master list that definitely catches everything. So sometimes you're also looking at research that has done a little bit of a different take on a similar concept. So you might see some different language as you're going through, especially when we start looking at some of those shared things. But if you're kind of looking at, okay, what could that concept mean versus just what exact words are there, you're going to see some different overlaps than if you're really strict with the language. So kind of thinking about the concept of the risk or protective factor. Favorable attitude towards drugs, that's usually, we usually kind of get at that by asking questions like, would it be a good experience for you to drink alcohol? Sort of those kinds of like, do you think, from kind of behavioral behavior change theory, it's like, do you think it would be good? Would you think you'd have a good time? Do you think it would be enjoyable? Do you think it would, there wouldn't really be any problems if you used, X substance? We know early substance use, right? That's a big thing we're often talking about in prevention. And we want to delay that onset of first use because we know that the longer someone waits, the more positive outcomes they're going to have in general around avoiding a substance use disorder and kind of minimizing those substance misuse risky behaviors. Looking at the family context, right? There's that poor attachment with parents, so that kind of gets at that quality of the relationship, a little bit more into the psychology piece of things. How connected to the family unit are our young people feeling? So that's one of those family context risk factors. And then one thing that sometimes folks kind of call out, because we know that at the college level, the kind of college age level, you'll see some things where it's a risk factor to be in a college environment, and then it's a risk factor to not be in a college environment. I think what this is getting at, the not college bound, is more getting at that goals for the future piece. We know that it's like having goals for the future is hugely protective. And we see here that something like this, that kind of like low commitment to school, not college bound, thinking not really necessarily having like a goal they're working towards. Now, obviously, some of our non-college bound kiddos might have great goals they're working towards, right? They might be like ready with an internship with a job. Maybe they're going to the military. Maybe they're going to something that, has a clear career plan. I think kind of in general, if there's not that plan for the future, that's where we start to see some of that risk. And, as we get here, again, that last bullet point, permissive societal and community norms about alcohol and drug use. We want to make sure, that can be a little bit harder to kind of pinpoint, right? You can kind of sometimes point to legislation, like here's a big impact. Sometimes it's getting to know our communities a little bit more in terms of just kind of like what are those messages our young people are getting about how good is it, how normal is it, how little of a problem is it if they are using alcohol or other drugs underage, or things that might be illegal in general. So this is not an exhaustive list, but we kind of pulled out what are some of the ones we often are looking at when we are looking at risk factors. Let's go to the next slide and we'll look at those protective factors. Again, it won't be an exhaustive list of protective factors, but yeah, thank you so much. But some of the things that are sort of those big picture things that we're often looking at when we're doing that coalition work or we're doing work in our schools or some of those direct services. So again, this is looking at, protective factors for adolescent substance use. at that individual context, positive physical development could look like a few different things, right? Some of that could be, I haven't gone back into the research. So I think if you were hoping to kind of focus on that one, you might want to do some research around like the specifics of that data, but something that does come up in different ways. Emotional self-regulation, right? We know that's a huge one, like having that ability to to write in your journal as opposed to like immediately rushing to a substance or talking to your friends or listening to music, or anything that kind of helps people move forward and that calming, that they can find that in themselves. That's a huge one, and definitely fits in with good coping skills, problem solving skills, a lot of those things that if we're working with young people directly, we're helping them develop. Family context, right? Supportive relationships, clear expectations. We talked about that earlier. A lot of the times, if you're doing some kind of parent engagement programming, that piece of clear expectations and how we communicate that to our kids is going to be a big part of what we're working on. We're hoping to shore up this protective factor. And you'll see right in our peer and community and school context, those opportunities for meaningful engagement. We know that across the board, that feeling of connectedness with your school setting as an adolescent is huge. It's a huge protective factor for a lot of different concerns that we might have. And going back to, if you're thinking about kind of Lori's presentation pieces, with the school piece, we really saw that there was that kind of elevated risk for folks who weren't getting good grades, right? When kind of didn't have that connection or hadn't found that academic piece that really connected with them. So we see it's really important. We saw a lot of clear data for New Hampshire that it matters here too. And then protection around like mentors and support for developing skills, interests, developing those, important adult supportive relationships. And then also just policies that lead to physical and psychological safety, right? That's a huge thing. Those could be school policies. They could be at the state level. They could be at the federal level. But things that threaten that, right, are going to be a problem in terms of, that they're not going to be there for a protective factor. One thing that's important is that sometimes risk and protective factors can be kind of the opposite of each other. Like if one isn't in place, then that impacts the other. So for instance, we know that having clear expectations for behavior and values is a protective factor in our family context. And we know that having non-clear, like low expectations or unclear expectations for behavior and values is a risk factor. But they're not always that kind of opposite relationship. So you want to make sure that you're not making an assumption that just because something is there isn't, that it's kind of impacting the other side of that coin. And the other thing just to hugely remember is when we're doing prevention work, these are the things that we are hoping to directly impact, right? We're not going in, we're not taking like a bottle of beer away from someone, right? We're not adjusting the behavior directly. Big reminder, just and everyone who's like ever taken the SAPS knows this too, right? Like, but it's so important to remember that we are working on the risk and protective factors because that's what the science says is going to work. We know that that's what impacts things. The research is there. We just have to focus on risk and protective factors in the work that we're doing. And if we can kind of communicate that well to those outside community partners, as we get into this idea of more shared risk and protective factors, we're going to see that real benefit to being able to talk about it and how their work and our work really connect with each other and how we can work together moving forward. All right, how about the next slide? Great. So this is that first, that link that Maura has put into the chat. So this is going to bring you to a big 2-page document. It's a lot. You don't have to read every word of it right now. It is definitely a lot of information that we'd expect you to be able to like sit with later. Like we want you to have access to this as we kind of go forward. But let me talk about how it's laid out because it's a really handy tool for kind of like drawing these connections. So if you go down to the second page, and actually I wonder, so yeah, are you able for our slides to click through to this link just so we can kind of show them in case anyone's like on a phone or, it's harder to like get to a file. Will it come up, Danny? I'm sorry to spring this on everyone.
Yeah, I can pull it up and share it on a separate separate screen here.
Okay.
Just 1 second.
No problem. I realize I was just gonna be talking about little spots on a page that might not be handy if you're not looking at the same thing.
Is this it?
Let's see. That is perfect. Danny, do you mind scrolling down to the second page from where you are? Perfect. That is perfect. So I just want to bring people's attention to this key down here in the bottom right corner. So what this is going to show you is that color-coded piece that is, oh, okay. Let's see.
I can see Danny's screen and the key.
Could
others chime in really quick and just let us know if you can see it or not?
Yeah.
Yeah.
I can see it as well. Yes.
Okay.
Okay, great. Thank you. Yes, thank you for checking in about that. So what you're going to see is that we got a color-coded key here, and it's going to be looking at, right, some of the big picture things that we've talked about today. So this is just risk factors. You're going to see risk factors for depression, anxiety, substance misuse, suicide, and intimate partner violence. It is color-coded. If you're someone who doesn't see colors too well, it is also in that order. So kind of, they're not like all mixed up between the different things. So what you can see as you go through it is really kind of what are some of those things that have been found for each of these. Yes, the colors correspond for each sector and are in that order listed. And then Danny, can you scroll up to the first page again? I think it gives us a little bit better of a view. Awesome. So you'll see here, we've got all of our different things listed here. Now, again, right, there's not one list that covers every research project that's ever been done or every journal article that's out there. But this gets at things that have, you know, that published proof that they are going to impact the issue at hand. So you can see things that are looking, you know, that are issues with risk factors for those different concerns. And then you can kind of compare, okay, where do we see some similarities and where do we see some differences? All right, so that's what that is going to look like. For our purposes, and just to be difficult, I'll then, if we can go back to the slideshow, I pulled out some examples of some of the where you'll see that overlap. So that file should be there for you to get. Definitely recommend kind of saving the link to that for the times that you might need to talk about some of those shared risk factors. All right. So let's take a closer look at some of the things that really on that list, we see those similarities. You can go to the next slide. All right. So let me get to fit to my window here. All right. So on the left side here, right, we've pulled out things that are risk factors for substance use disorders, right? So when you are looking at that big 2-page chart, it's that substance use piece, right? So often that's where we in our roles are kind of starting from. So if that's the case, we've pulled out some of those risk factors and looked at, okay, where do we see those shared things? Where can we have these conversations and get those ideas out to people of if one of us is working on this, then that's going to benefit the work of all of us. So kind of at that individual level, you can see that childhood emotional problems and difficult temperament. And some of these concepts are a little bit, you might see them written about in different language. But if we look at that, we see that overlap with depression and intimate partner violence. So, and looking at early substance use, right? Looking at early substance use, we see that overlap with suicidal ideation or suicide behavior. So you can kind of see some of the things, take a moment to read down the chart and see where you have some overlaps and maybe think for a moment about, all right, if I know that this risk factor is also influencing and being a part of, the outcomes of some of these other issues, who might I partner with? Who might I think to have the conversation with to point out, hey, like, if we work together on academic achievement and kind of increasing that for folks, people who care about mental health but don't really know whether they, maybe don't have a big connection to substance use disorders, that's going to be a great overlap for us to really bring those mental health professionals and those mental health advocates to the table and be like, here's a thing that helps us both. And here's a thing that helps if we, combine our forces and work with our young people around this, we know that's going to have, an impact on multiple potential negative outcomes for folks. So this information is pulled from that 2-page document that you now have. So this is just kind of another way of looking at it and kind of calling out some of those overlaps and where we see those shared risk factors in this case. So in that light, let's look at those protective factors. If we go to our next, slide. Maura, is that something that you're able to share in the chat as well? And I'm thinking, Danny, if you wouldn't mind just clicking through to that and doing that same thing, that would be fantastic. We can, just to get people comfortable with what file they'll now have that access to. The shared protective factors file is set up a little bit differently. You'll see it's kind of like the public health agency that we pulled it from had kind of done a little bit of that work before, that work for us. And so really had already kind of looked at, okay, when we're looking at mental, emotional, and behavioral health disorders, so maybe we're looking at, violence prevention and substance use disorder prevention and, looking at positive outcomes in terms of depression and anxiety, where do we see like a huge amount of overlap? And so that's going to be you're going to get a sense of that in this document. So some of the things, right, we talked about some of them, we pulled some of those out. Dan, if you wouldn't mind scrolling down just a little bit, I just want to show people, perfect. We did, because suicide and intimate partner violence weren't originally included in this, we went through some of that information and notated this, right? So you'll see if there's an asterisk over it, next to it, that also is related to suicide prevention. And if you see that plus sign after one of those, that means it's also shared with intimate partner violence. So that's a little bit of how to read this. So this is really something that's going to include all of the things from the other chart, just in a little bit of a different look. And we talked about a lot of these examples. All right, so why don't we go back to the slideshow, but that's a little talk through of what you have in this document. And as again, thinking about who are those folks we can have a conversation with? Are there partners that aren't quite, at our coalition meetings yet, who might be interested in this, who might be interested in the data that we have from the YRBS, right? Who are those folks that might be interested in the data that Lori shared with us? And then we can come in with some of those answers. Like, then we know what are some of the things we can actually do about it. What are some of the things that impact this? So kind of, leverage our knowledge, our expertise as substance use disorder prevention professionals, and then kind of bringing more people to the table. So, maybe there's, a community health organization that has more of a mental health focus. Maybe there's an organization like Seacoast Outright, which I think is changing to like New Hampshire Outright in some way, that's working with certain populations that we see more risk for. So like our LGBTQ plus folks, kind of thinking about who are those folks out in our communities that might not already be keyed into what we do with substance use disorder prevention, but might be really interested in working on these other things and being those really cool partners that we haven't traditionally worked with. Dan, if you want, you can go to the next slide. Yes, so kind of, what are we thinking in terms of if people have questions? Happy to answer any of that. I know we'll kind of then go into our Q&A in general for both Lori and myself. But just kind of wanted people to kind of think about, who can I talk to about this? Like, not just kind of having this amazing information from Lori, all that data and kind of some of these ideas of what to work on, not just have it sit in this time that we have together, but really think about who do I tell about this? Who am I going to take this out to? Because it really can provide us with a great direction to enhance the work that we're doing and to kind of get more bang for your buck, to really, enhance the wellness of our kids that we're working with. So that's kind of my piece of it. I think we had one more slide in there of just a reminder of how you can reach us. Oh, we had, yes, also some resources. This is what a lot of the information was pulled from. And then there's that, yeah, that first one is kind of that big classic book. And then we kind of added to it for a little bit more of those updated SAMHSA sheets that they are around. And then maybe there's one more slide of how to reach us, where you might find us, if you have questions. I'm happy. I'm going to throw my email in the chat if there's anything I can help folks with, or direct you to a resource that you haven't found yet. And thanks for letting me talk about a thing I feel pretty passionately about, which is shared risk and protective factors.
Thank you, Marissa. That was super informative and really tied into Lori's presentation for all of us. I would like to just give everybody an understanding of where all of this is going. So we have been looking at our COP format over our last year and have determined that maintaining a collective vision over the next year of what we're going to be presenting on is a very important issue that we want to focus on. And so the three areas are mental health, SUD, and teen dating violence, and how all of them interact with one another. And so we wanted to kick it off with a presentation about what the 2023 YRBS looks like, and then risk and protective factors across all of our systems. And like Marissa said, start thinking about who you're working with and who you're not working with, and how they can really fit into all of these pieces to really wrap around the students and the families and the folks in New Hampshire that we're working with and for, and trying to help make New Hampshire a better place, and focus on these different process, if you will. And so I just wanted to open the floor up for questions. I think we have about 10 minutes or so. So please feel free to come off mute or pop your questions in the chat for Marissa or Lori. Catalina, I was going to ask if you wanted to jump on and say any more about your comment in the chat.
Yes, thank you. I'll jump in. So just as I mentioned in the comment, as we know, this year is a state budget year, as incoming elected officials are going to be looking at the state budget. And so it occurs to me that it is an opportunity for us and for anyone who's here today from any of our many public health networks. You know that many of us are going to be doing some advocacy work as part of the overall, work plan of what we do. And so it occurs to me that we can take some of those the data that Lori shared, that's what's trending or what's rising to the top as far as what our New Hampshire kids are telling us that they're facing and they're struggling with, and then combine that with, the information that Marissa really nicely outlined in a way that's very clear and easy to read. Thank you, Marissa, because we can get very wonky with our language in prevention work, but this is very easy to read. And so that we combine, what our kids are saying with what we know that best practice says helps kids to be healthy. And then it seems to me we should be able to craft a message to the people who represent us to say, knowing this is what our kids are facing and knowing this is what helps kids be healthy, please, keep that in mind, because you're going to have opportunities to advance policy and advance funding and advance, other types of, collaborations across the state to, to have like an evidence-based, data-driven, solutions to, things that are within our control to do to help our kids in New Hampshire.
Thank you, Catalina. We received another question, and Lori or Marissa, I don't know whichever one of you would like to come off mute. Was income basic needs being met a question in any of the surveys in any capacity? Lori, I don't know if you can speak to that about the data that you pulled, if basic needs was looked at all.
We were looking at YRBS data specifically. Now I think that the one category that we saw show up consistently, students, trading sex for housing, food, money, that would indicate for those students that was something they were doing to get the resources they needed to survive. YRBS doesn't ask questions about income, but we could look at other data sets to tease that out. There is a question there are some questions sleeping away from home, some other things. I don't think those were looked at in this study because we were really, looking at mental health, substance use, and dating violence. But we've only scratched the surface. I mean, there are unlimited numbers of stories in YRBS data, and we certainly could look at that.
Thank you, Lori.
I will say for some of the research that's been done around risk and protective factors, there's definitely places where that comes into play. It didn't kind of like rise to the top when we're looking at some of those shared things, but I'm sure again, if you have that focus, you can often put in some search terms into like Google Scholar and kind of see what might be out there in terms of whether it's again housing insecurity or food security or poverty levels or things like that, like as search terms with SUD risk or whatever kind of risk you're looking at. You can usually kind of find a trail to investigate further.
Also, just to plug our DHHS website, if you visit YRBS on the DHHS website, you can often filter by the different questions or categories on there, and that will direct you to the questions that are based around basic needs or as housing instability or whatnot. So you can look on there. I can put the link in the chat as well. Does anybody else have any other questions? I also want to highlight Jillian put in a bunch of information about advocacy in New Hampshire and some new futures trainings that are coming up and some options that you have to understand the state budget and understand what's going on at the State House and all of that good stuff. So take a look at that as well. I have a question really quick while we have you both. And Marissa, you may know a little bit more about this, but you had highlighted Seacoast Outright as another organization that you work with and you see being really on our risk and protective factor kind of wavelength, if you will. Do you have any others in New Hampshire that you think that we're missing an opportunity to connect with that we could be connecting with off the top of your head? That you'd like to highlight? Sorry to put you on the spot.
That's a great question. I was thinking so much of like, oh, I want people to think about that at their local level that I like did not carry on that direction of thinking. So that is probably yes, a question for the chat. And NAMI, Stay Work Play New Hampshire, like for our young professionals. Haven, if you're working out in kind of the eastern, kind of southeastern part of the state around domestic violence. There's also, I know and I'm going to get the acronym wrong, but there's like the New Hampshire Network around sexual violence. Whose acronym I forget, but someone might be able to put it in the chat. Awesome. Yeah, the Youth Success Project around youth homelessness. That was, yes, Janelle put the acronym that it had escaped me in there. Yeah, yep. So yeah, I and I can email and like follow up. We can probably kind of brainstorm between this and what's in the chat and what's in our brains around some resources to follow up with. It's a great question.
And I just want to put that out there too, that if anybody else has some that come to mind as we're continuing to build our community of practice over the next couple of months for the remainder of the year, please reach out to myself or Melissa, somebody from Growth Partners or BDAS to discuss other organizations that you would like to learn more about and how you can integrate your prevention policies with their already existing prevention policies and, work together. So we're sharing our risk and protective factor education across everybody. So thank you for all of those really wonderful
Candace,
comments.
I have a comment. I think that, just coming off the New Hampshire Behavioral Health Summit, I wrote in the chat about, wishing that there was like a youth mental health track, because it is like a huge summit. But it dawns on me today, as an original kind of preventionist, that we need to sort of, I think, acknowledge how far prevention has come from where it was like kind of squishy in the 90s to it being hardcore data driven now. And we need to make that leap for people because they still don't, I guess, maybe connect the dots that how do we measure that prevention works, right? And that's, I think, telling the story through data and risk and protective factors. So what was great is, Lori sort of looked at the broad strokes of the 2023 data with dating violence incorporated. And then Marissa talked about sort of the shared risk and protective factors. So what's the solution, right? So we gave the data, the problem, and then we gave the solution. I think that's sort of a great menu to offer people that don't normally interact with prevention as a whole body in New Hampshire.
One more partner I would suggest if they're not at the table already is the network of child advocacy centers, because they are working directly in the area of sexual abuse as well as other kinds of abuse, and I understand have very good data systems in place.
Awesome. Thank you. Yeah, we're getting some really great suggestions in the chat as well for future COPs. So one last question. Any more questions before we wrap it up and I throw it back over to Melissa and Danny to tell you about our evaluation?
Just real quick, I want to, shout out to New Futures, and they posted the information in the chat, but they have a whole, winter's calendar of Advocacy 101 and learning about the state budget. And, please go check those out and jump in. They are such a tremendous resource, and they're going to be identifying policy priorities related to children's behavioral health. So if you don't already follow their web page, they're a fantastic resource.
Yes, thank you for highlighting that. All right, back to Melissa and Danny to wrap us up. And thank you, Lori and Marissa, for a wonderful presentation.
Thank you very much. So yeah, before we wrap it up, we want to thank the speakers for the great presentation today and also for the questions and added information we received right at the end there in the QA session. Before we finish, we want to remind you of the resources available at our website, nhtac.org, where you're going to find the recording of this session that we had, this COP, but the ones previously done as well for future reference, and other resources available there. Also, if we also want to remind you, if you could take a few moments to fill the evaluation. We're going to see it on the screen right now, but if you're unable to scan the QR code, I'm going to post it here. Oh, thank you, Melissa. You already posted it there. So if you're unable to scan the QR, just follow the link that is in chat. The feedback is really important to improve these sessions and make it as productive for you as possible. With that, we can wrap it up today. Thank you again for joining us, and have a great rest of your day. Enjoy your holidays, and we look forward to seeing you at the next COP. Have a good one.